The AANA is pleased to present the Wellness and Chemical Dependency in the Nurse Anesthesia Profession curriculum to increase awareness and knowledge of the need for each of you to be healthy and well. Many of you are viewing this curriculum as nurse anesthesia students. We're excited to have you begin this fulfilling profession. We believe it is imperative that you learn about occupational risk for addiction at this early stage of your anesthesia education. Equally important is for you to discover the need to adopt and employ healthy lifestyle behaviors throughout your professional tenure. Some of you are further into your careers and may personally know colleagues who have suffered the consequences of turning to unhealthy habits, such as drugs or alcohol, to cope with personal or professional stress. Whatever your career stage, professional lifestyles that promote effective coping, adaptation, and resilience can be taught, learned, and adopted. These modules provide a number of simple but essential elements to forge a long and healthy career. The overarching goal is to create a healthier workforce and, as a consequence, to optimize patient safety. Curriculum is presented in 6 modules. Each can be viewed independently by the learner at any time. Module 1 and 2 introduces general concepts and the dimensions of wellness, the threat of stress, and the need for resilience. Module 2 explores specific stress research data from the CRNA and student nurse anesthetist populations. Module 3 expands on these concepts, addressing specific healthcare stressors, and introduces the risks for chemical dependency and addiction. Module 4 imparts a broad overview of the disease of addiction, along with the signs and behaviors to recognize an impaired colleague. It also presents an introduction to understanding of mental health conditions, such as burnout and depression, and the impact of these on overall well-being. Module 5 speaks further to the consequences of the disease of addiction, introduces treatment and recovery, explores the challenge of potential reentry to the profession, as well as relapse. Module 6 highlights the concepts from the first 5 modules and offers resources for creating and sustaining a personal wellness plan. We hope that this curriculum introduces each of you to the concept of building your personal wellness arsenal of coping skills and resiliency strategies. The learning will facilitate the development of a healthy approach to stress reduction throughout your life. Finally, it will focus on the elements of sustaining healthy relationships, diet, exercise, and carving out adequate time for recreation as well as sleep and restoration. With knowledge as power, we envision that the increased awareness brought about by engaging with this module series will help reduce the incidence of substance abuse by CRNAs and student nurse anesthetists. It is further hoped that this knowledge may also prevent the threat of untimely death related to substance abuse in the anesthesia provider population. An impaired provider poses great threat not only to themselves, but also to the patients in their care. We encourage nurse anesthesia educational programs to advance wellness and chemical dependency education during the student orientation and inculcate these principles throughout the program. The goal is to strengthen knowledge and coping skills and proactively seek balance to avoid professional and personal vulnerability. The AANA thanks the Curriculum Task Force volunteers who contribute to the content of these modules.
Module 2, Stress, Understanding Causes and Consequences. In this module, we will talk about what stress is and what are stressors. We will also ask you to look inside yourself for symptoms you may display and think about how best to manage them. We will discuss the causes and consequences of stress. The consequences may be physical, emotional, or psychological. We will also discuss the implications of stress on physical illness, how to increase your margin, and ultimately how to become more resilient to outside influences. Unlike our ancestors, most modern stress is mental rather than physical. We no longer have to worry about large animals outside of our homes who would love to have us for lunch. Stressors are different for everyone. What one person sees as extremely stressful may have little impact on another, but everyday life can be challenging. While you are in anesthesia school, you not only have the everyday stresses of relationships, finances, and living, but you also have the demands of a rigorous professional and clinical education. The chronic stress of healthcare professionals has drawn urgent attention over the world. Stressors are reported to have an adverse impact on workers, including fatigue, decreased job satisfaction, depression, and suicidal risk. Concentration and professional decision-making abilities may also be affected. As a result, absenteeism, decreased quality of care, medical errors, and burnout are not uncommon. With actual or anticipated budget cuts to healthcare systems under the financial crisis in many parts of the world, these issues are going to be even more prominent in future years. Excessive workload shift work, prolonged working hours, staff shortage, high turnover, professional conflicts, and role ambiguity are common stressors. What are we stressed about? Quite simply, everything. There are 4 types of stress that individuals may have. The first is general stress, and this is one that all of us have. It involves the stresses we come under during daily living. Usually these stresses are manageable and do not need an intervention. But if they don't go away, they lead to other types of stress. Cumulative stress involves individuals who are constantly bathed by stress hormones. Eventually, they start to show the physical and emotional tolls the stress brings. They suffer mental anguish, and it becomes more difficult to alleviate the symptoms. For students going to school, this type of stress is a real possibility. As pressure mounts from daily activities, clinical duties, classroom examinations, etc., the stress becomes more difficult to manage. If you do not take the time to care for yourself, it becomes more and more difficult to concentrate, learn, and perform. Acute traumatic stress is caused by an individual's subjective experience of an extreme traumatic event, which can lead to extreme stress that inhibits a person's ability to cope. There is no clear division between stress and trauma. However, we know that stress can lead to trauma, which leads to adaptation or may develop into post-traumatic stress disorder. Post-traumatic stress disorder. According to the National Institute of Health, PTSD is an anxiety disorder that can be experienced after seeing or living through a dangerous or traumatic event. A traumatic event can be experienced, witnessed, or learned about in which grave physical harm occurred or was threatened. The traumatic event causes the person to feel intense fear, terror, or a sense of helplessness. CRNAs and other healthcare professionals face workplace situations, such as adverse critical events, that can trigger PTSD when the acute traumatic stress caused by an incident goes unresolved. Military personnel, including military nurses in service to our country, can have an increased likelihood of PTSD because of exposure to ongoing stress produced by severe psychological trauma. Stressors or events that evoke stress in an individual vary among all of us. What may be stress-provoking in one individual may not be in another. Further, we each have different built-in abilities to adapt to stress. The knowledge, skills, and administration of anesthesia is learned and practiced in a stressful environment. In the classroom, students are bombarded with lectures, skill challenges, and the emotional experience of no longer being the expert in the nursing unit, but a novice in a new environment. In the surgical setting, the actions that we take, or those that result from the actions others take, can cause changes in our patients that ultimately lead to increased stress in ourselves. Our ancestors used the responses of fight or flight to cope with the daily pressures of survival. Unfortunately, nurse anesthetists cannot adopt these same responses to cope with the environment of school, their jobs, or everyday life. Fighting or fleeing is not an option. Coping, negotiating, acquiescing, and reconciling are the more frequent and demanding choices. The release of hormones from the sympathetic nervous system allows us to function at a heightened state. Our heart rate, blood pressure increase, our bronchi dilate, and our body mobilizes more fat and glucose to allow for increased activity. Digestion decreases and our sensory activity increases. These actions prepare us for what is to come. the body doesn't distinguish between physical and psychological threats. When you're stressed over a busy schedule, an argument with a friend, a traffic jam, or a mountain of bills, your body reacts just as strongly as if you were facing a life or death situation. If you have a lot of responsibilities and worries, your emergency stress response may be on most of the time. The more your body's stress system is activated, the easier it is to trip and the harder it is to shut it off. Long-term exposure to stress can lead to serious health problems. Chronic stress disrupts nearly every system in your body. It can raise blood pressure, suppress the immune system, increase the risk of heart attack and stroke, contribute to infertility, and speed up the aging process. Long-term stress can even rewire the brain, leaving you more vulnerable to anxiety and depression. First, an event occurs of neutral value or meaning. All of us have different skills and perspectives on events we encounter. Each individual has to appraise whether an event is going to threaten or challenge us. Biochemicals are released to enhance the ability of one's mind and body to respond. If we perceive it as threatening, we are bathed in stress hormones that ready us for fight or flight. Biochemicals are then depleted through the exertion to meet the threat or challenge. As the level of hormones increase, we utilize much of our physiological reserve and we become fatigued, a condition that will be maintained until we have an adequate rest period. Learning during this heightened state is difficult, and many of the long-term connections our nurse anesthesia students need to function in this profession are not strengthened. After a period of rest, the individual is able to prepare for and meet a new threat or challenge. As we are stressed, our body is flooded with powerful mediators such as epinephrine, norepinephrine, prostaglandin, and other stress hormones. These prepare us for fight or flight. In our patients, we know how to treat these stress responses, but we never think that they are going on within ourselves also. When the danger or stressful event has passed, these mediators are broken down quickly, but they leave us less able to react later. These behaviors can be observed as symptoms of an individual in stress. Personally and professionally, these continued responses will have a negative effect on your performance by reducing your effectiveness, making you accident-prone, causing you to be forgetful, causing you to be very negative. You may neglect your appearance, make poor judgments, make more mistakes, and increase your absenteeism. Symptoms of stress can be exhibited both physically and psychologically. Keep in mind that the signs and symptoms of stress can also be caused by other psychological and medical problems. If you're experiencing any of the warning signs of stress, it's important to see a doctor for a full evaluation. Your doctor can help you determine whether or not your symptoms are stress-related. One of the psychological consequences of stress is burnout, as previously discussed. This can endanger our emotional well-being. All anesthesia providers know the effects of the surgical stress response on patients. This response protects the patient and leads to increased heart rate, blood sugar, blood pressure, and metabolism, while suppressing vital functions such as immune responses. These are normal biological and psychological functions mediated by hormones released by activation of the hypothalamic pituitary adrenal axis to help cope with challenging physical events. According to Sandra Tunacek, author of the AANA Wellness Milestone Columns, nurse anesthetists spend endless hours dedicated to the workplace, where they are constantly exposed to a variety of stressors. Studies note that protracted stress has significant physical and mental consequences for healthcare professionals that can affect health, sometimes to the point of disability, and may even affect patient care. Stress can result in disruption in relationships, fatigue, headaches, gastrointestinal disturbances, weight loss or gain, insomnia, depression, even addictive behavior. CRNAs often do not recognize that the same stress response we count on and acknowledge in our patients is also at work in our own bodies due to both stress on the job and in our personal lives. Stress is the body's way of reacting to different situations, both good and bad. Chances are that if we are feeling stress at work, we are likely to experience stress in other aspects of our lives. One of the biggest challenges to our profession are internal and external forces. These figures are reported stress-related illnesses from Dr. Chippis et al. Stress surveys of CRNA and student nurse anesthetist populations in 2008 and 2010. There are numerous signs and symptoms of stress that many of us are unaware of. Not everybody develops exactly the same symptoms. Research has indicated that, although there are common symptoms of stress, individuals vary in the symptoms they present. Some of us may have mainly physical symptoms, such as muscle pain and tension. Others may present with emotional or psychological symptoms, such as crying or anger. Learning the signs and symptoms of stress can help us become more aware of the problems stress can cause in our lives. It's important to learn how to recognize when your stress levels are out of control. The most dangerous thing about stress is how easily it can creep up on you. You get used to it. It starts to feel familiar, even normal. You don't notice how much it's affecting you, even as it takes a heavy toll. The signs and symptoms of stress overload can be almost anything. Stress affects the mind, body, and behavior in many ways, and everyone experiences stress differently. Everything can be a stressor. Do you recognize any of these stressors in your life? But stress does not need to always be a negative thing. It can also have a positive effect, spurring motivation and awareness, providing the stimulation to cope with challenging situations. Stress also provides the sense of urgency and alertness needed for survival when confronting threatening situations. If we were completely stress-free, we would actually lose vigilance, something that is necessary for us to safely care for our patients. So not all stressors are bad, just different. Daily events, like love or winning the lottery, come with their own stressors. These can be as perplexing to us as negative stress. Stress gives us some sense of alertness and allows us to maintain control. However, we need to control stress rather than letting it control us. Stress opens the window of vulnerability to negative consequences of stress. Stress was found to be particularly high in nurse anesthesia students and nurse anesthesia educational program faculty. In the Chippis surveys in 2008 and 2010, self-reported stress levels were significantly higher in the students group with a mean stress level of 7.96. CRNA educators had the second highest stress levels with a mean score of 6.4, while CRNA clinicians showed a significantly reduced level of 5.2. One of the psychological consequences of stress is burnout, as previously discussed. This can endanger our emotional well-being. Stress may also cause disruptions in personal and professional relationships, which creates a social wellness imbalance in which you may not be giving, or others may not be receiving the support that is needed. The consequence of fatigue may leave one feeling less excited for normally enjoyable activity. Fatigue also contributes to poor choices, physical illness, and the loss of mental acuity. Weight loss or weight gain is another consequence of stress. In the majority of cases, stress causes weight gain, but some people experience weight loss. It all depends on how you react to stressful situations. Even if you don't overeat when you become stressed, you will still gain weight because the energy that should be used to digest your food is now used to cope with stress. Depression is one of the more severe consequences of stress. If you suffer from a lot of stress, this will wear you out and cause you to lose zest for life. You will see only the negative sides of any situation, and this will make you upset or even depressed. When you get regularly stressed, you train yourself to focus on the things that make you upset or angry. Depression is a disabling disorder that can disrupt an individual's occupational, social, and physiological functioning. The lifetime prevalence of major depression is estimated at 16% in the general population. University students represent a group thought to be at particular risk for developing depression and emotional disorders. Indeed, according to Compton, depression is one of the most common psychiatric disorders affecting university students, with current prevalence rates estimated at 10% in undergraduate samples. The prevalence of depression may be due in part to the myriad stressors confronting students, that is, financial concerns, academic performance, and relationship issues. Such stressors represent significant predisposing factors to developing depressive symptoms. Depressive symptoms in students can compromise learning and memory processes, adversely affecting academic performance, and are associated with drinking problems and suicidal ideation. Compton identified a rate of depression among medical students and residents at 7 to 14%. Many students in this study exhibited the Diagnostic and Statistical Manual of Mental Disorders criteria for major depressive disorders, including restlessness, depressed mood, weight gain or loss, agitation, insomnia, hypersomnia, decreased ability to concentrate, and loss of interest in usually pleasurable activities. This rate of depression, 47%, is significantly higher in nurse anesthesia students than those reported by Compton in medical students, residents, and the general university population. Suicidal ideation is another serious consequence of stress. In a study conducted by Chippis in 2010, depression was one of the most disturbing trends noted. 245 respondents, 21.3%, expressed thoughts of suicide at some time during their education. According to Compton, suicide is the third leading cause of death in the U.S. for individuals 18 to 24 years old, and the prevalence of reported suicidal ideation is highest in this age range. This high rate of suicidal ideation is very disturbing in the nurse anesthesia population and speaks to the increased stress they are placed under. When comparing the means, there was no difference between male and female students in this suicidal thought process. And finally, the rate of addiction is extremely high in nurse anesthesia. Stress is one of the leading causes of this crisis in our profession. Alleviation of stress and depression within our student population is important if this rate is to be lowered. Nurses are good at recognizing and managing stress in their patients, but poor at recognizing it in themselves. Self-awareness needs to be encouraged in all anesthesia professionals. Our nurse anesthesia programs do a good job of teaching students what they need to know to manage and provide anesthetics, but are somewhat lacking in talking about managing oneself and stress. The Chippis Wellness Survey results indicate that many of our students and CRNAs are managing stress in maladaptive ways. The use of alcohol and medications to cope with stress are much less healthy than natural ways to promote physical and mental well-being, such as positive coping mechanisms like exercise and enjoying life. Of the 1,200 students who responded to Chippis's 2010 Wellness Survey, fully 30% indicated that they had sought help for stress reduction. This is an increase of 5% over the previously reported data from the 2008 Wellness and Burnout Study conducted by Dr. Chippis. Nutritional needs usually increase under consistent stress. Both diet and sensible supplement use can help fulfill these nutrient needs. Protein should be increased, but without fat. In other words, don't start eating processed meats or steak. Instead, select low-fat foods, fish, poultry, or beans. You'll be better off eating a non-fat protein supplement and vegetables. Fiber, increase it. Many of the bad effects of stress cause higher bile output. This could mean gallstones in the future, plus bowel problems and elevated cholesterol in the present. A good fiber supplement and a high-fiber diet make a lot of sense and relieve many of the ill effects of stress. Vitamins and minerals. If there were ever a reason to take a good balanced daily multiple vitamin or mineral supplement, stress is it. In addition, extra balanced B-complex and extra vitamin C can make up for both shortfalls and losses through elimination, which seem to accompany stress. Calcium. The added losses in nutrients often show up as calcium loss. An extra 1 or 2 calcium tablets daily can help offset this problem. Managing stress can be as simple as getting it. but it involves utilizing positive coping mechanisms, such as activities that we find restful and energizing. Simple things like rest, trusting someone, organizing life, and realizing that we cannot always do things on our own and we may need help. More exercise, starting or increasing exercise, can be extremely useful as it releases endorphins that make us feel good. Set a goal for at least 20 minutes 5 times a week and break a sweat. Release those good endorphins. Less anger. Anger can be an extremely uncomfortable and confusing emotion, and everyone has their own way of handling it. Anger can affect your health or may cause you to overreact in certain situations. Have you ever worked with a partner and had them fail to do what you thought they should do? How did that make you feel? We often get angry because those around us have not done what we thought they should or when we thought they should have. Some people immediately become hostile or aggressive in response to their anger and its related tension. Some of us may have learned to internalize anger deeply, while others have learned not to experience anger. Instead of anger, these individuals may experience depression, pain, excessive guilt, and shame. Holding the anger in usually creates stress, and stress can raise your blood pressure. It can also raise your heart rate and tie your muscles up in knots. When we make sense of anger and learn ways to constructively manage it, we can experience less stress, a new freedom, and increased real control in our lives. Why use humor in daily life? The answer is simple. You get immediate results. It takes no special talent or ability, no physical prowess or skill. You aren't required to have a master's degree or a license. It makes you feel good, it's fun, fat-free, and you don't need batteries. A good laugh may be good for the heart. A team of Maryland medical researchers found that people with heart disease were 40% less likely to laugh in humorous situations than those with healthy hearts. The old saying that laughter is the best medicine definitely appears to be true when it comes to protecting your heart, says Michael Miller, director of the Center of Preventive Cardiology at the University of Maryland Medical Center. A good laugh has great short-term effects. When you start to laugh, it doesn't just lighten your load mentally, it actually induces physical changes in your body. Laughter can stimulate many organs. Laughter enhances your intake of oxygen-rich air, stimulates your heart, lungs, and muscles, and increases the endorphins that are released by your brain. It can activate and release your stress response. A rollicking laugh fires up and then cools down your stress response. The result? A good, relaxed feeling. It can soothe tension. Laughter can also stimulate circulation and aid muscle relaxation, both of which help reduce some of the physical symptoms of stress. Managing stress constructively rather than destructively is vital. Use of alcohol and drugs for stress management is counterproductive and may lead to addiction, injury, or even death. We should always look for balance in our lives. But most of all, find some way to relax. We all have our own ways of relaxing, so look within yourself and find that balance point. Doing something you like is important, but you always need to find some time for yourself without thinking about school or work. Margin is defined as the amount allowed beyond that which is needed. It is held in reserve for contingencies or unanticipated situations and is the opposite of overload. The opposite of having margin is marginless living. Marginless is being 30 minutes late to the doctor's office because you were 20 minutes late getting out of the hairdresser's, because you were 10 minutes late dropping the kids off at school, because the car ran out of gas 2 blocks from the gas station, and you forgot your purse. Dr. Richard A. Swenson, in his book, Restoring Emotional, Physical, Financial, and Time Reserves to Overloaded Lives, recommends using healthy coping mechanisms which can increase margin and build reserves to deal with stress and crisis. Adequate or inadequate reserves of margin can impact emotional and mental health. When demands of our busy lives, school, and work deplete these reserves, we become overloaded easily. This leads to less control over how we deal with stress in our everyday lives, which can lead to problems such as depression and chronic diseases, according to the Center for Disease Control. The difference between having margin and marginless living is marginless is fatigue, margin is energy, red ink, black ink, hurry, calm, anxiety, security, culture, counterculture, and reality versus remedy. The impact of marginless living is that when people present as distressed and often depressed, they know something is wrong but are not sure what. The ramifications of marginless living are that there are now more mental health professionals than police. Spending for mental health has increased more rapidly than any other health category, including physical illness. Highly motivated individuals, such as CRNAs, are challenged by lack of control of situations. Professionally, marginless living places you and those you care for at risk. There are many ways to restore emotional margin. Some of the ways are to have a pet. Research has shown that pets not only provide emotional support, but might also help their owners stay healthy. Reconcile relationships. Nothing drains more emotional strength than anger. Reconciliation allows one to better center themselves and regain margin. Laugh. Laughter is a healing activity. It's free, has no negative side effects, and is always available. Cry. Show emotion rather than bottling it up. Create appropriate boundaries. Encroaching on others' space creates stress in both of you. Envision a better future. Always look at where you are going and realize that the light at the end of the tunnel is not necessarily a train. And above all, love. Resilience can be learned and enhanced. Being resilient does not mean you won't experience difficulty or stress. It only means that in dealing with inordinate life demands, you will be better equipped to cope. Once strengthened with resiliency skills, in the event of an adverse situation that cannot be resolved, you will be able to continue living with it more competently. The precise nature of the network of relationships between risk and resilience factors, the conditions under which resilience is best fostered and risk most effectively moderated, are topics of ongoing research investigation. In general, experts agree resilience is related to meeting individual need for love and belonging, respect, identity, power, and meaning. When these personal needs are met, they become assets that benefit the ability to be resilient. The resiliency assets can be internally felt emotions and externally observed behaviors. Internal assets include feelings of social competence, autonomy and a sense of self, and a spiritual sense of meaning and purpose. External assets are caring relationships, high expectations, and meaningful participation and contribution. Combined, these assets can contribute to psychological hardiness. Each individual possesses their own level of personal resilience and inherent personality that affects how they cope with stress. Personal resilience patterns are complex and include situational aspects such as your approach to stress and problem solving, dispositional aspects such as your sense of self, general temperament, and health, relational aspects such as close relationships and social networks, and philosophical aspects such as personal beliefs and self-knowledge. Although you are born with some of these traits, resilience can be learned as well by concentrating on developing the positive aspects of each of these patterns. For example, improving your close relationships and support systems. Other things that contribute to your positive coping mechanisms are your personal response to stress, how well you are taking care of yourself, and how you adapt or reframe the stressful situation. In conclusion, we're concerned because chronic stress is insidious and ultimately more devastating than acute stress. This type of stress does not let up. Our bodies are continually bathed in the stress hormones from the HPA axis. These stress hormones affect us on a daily basis and may ultimately destroy minds, bodies, and lives. As we get used to chronic or long-term stress, we tend to forget it is there because it is not new. Chronic stress does not get our attention until its damage is done. Personal resources, both mental and physical, become depleted, leading to illnesses such as obesity, hypertension, heart attack, and stroke, ulcers, violence, depression, substance abuse, and decreased ability to concentrate and learn. These physical, mental, and emotional reactions result in exhaustion when a person's individual threshold is breached. The complex causes of chronic stress may include factors from work or home. These stressors may stem from financial pressures, interpersonal relationships, including anger management issues, or a non-supportive environment, emotional or physical. Any or all of these may lead to a lack of self-care. All too often, self-care becomes the lowest priority in our already demanding lives. Once our wellness is compromised, it opens the window of vulnerability to negative coping mechanisms and unhealthy behaviors, which lead to physical and psychological illness and addictions. It is the hope that through these modules, you will develop some of the knowledge and tools that will help you improve your positive coping mechanisms and have you well on your way to resilient behavior and a sense of well-being.
We hope the content from the Wellness and Chemical Dependency in the Nurse Anesthesia Profession curriculum modules will help each of you care for yourself as well as your patients. When you complete the curriculum, you'll find an increased knowledge of the occupational risk of chemical dependency in anesthesia professionals. The curriculum is designed to encourage you to build the ability to cope with stressors and to recognize the signs and behavior of an impaired colleague, as well as resources to find the available peer assistance when needed. The AANA provides supportive and supplementary information to this curriculum online. Go to www.aanawellness.com and follow the link for wellness, education, and research.